Hi, everyone. Welcome to Staying Compliant with KW Advanced Consultant. My name is Keisha Wilson. I'm the founder of KW Advanced Consultant. And thank you so much for joining us, for subscribing, liking, sharing. Super happy, thankful that you guys tune in to hear what we have to say to help you stay compliant. And so, just quickly, I wanted to mention to you all as we get ready for 2026. Now is the best time for your organizations to set plans in place for 2026. And what are you going to look at when it comes to audits? Whether you're auditing for evaluation and management services, for risk area, for risk adjustment. Documentation is super important. It is a legal record, it is a legal document, it is used in every area that we could think about, right? Internally for audits, for continuity of care, if a patient is going to see a specialist. If the Department of Justice or OIG decides to audit, and we hope so, because we hope not, right? Because I always say I like that orange, but not that type of orange. They would use that record, right? So we always want to make sure that it's up to date, that it's concise, that it's meeting medical necessity, that it is complete, right? And when I mean complete, that it is signed. We know which provider render those services. So you want to set a plan in place, right? We're starting the new year. We're coming off of FY 2026, the Federal Registrar. If you haven't read the thousands of pages, you want to take a look at what they're looking at. There's a lot of changes, and we'll do another video to say what they're looking at. But right now, I just want to talk about a few things when it comes to documentation, right? Evaluation and management services. Again, whether you're doing it to support an E&M or you're doing it for risk adjustment purposes, you want to make sure a few things with evaluation and management. One, that there is a clear chief complaint, and I don't mean follow-up, right? We want to say follow-up of what, right? Congestive heart failure, diabetes, swollen ankles, right? Shortness of breath. You're telling us why the patient is there today and just not follow up. We also want to make sure we have an appropriate history and or medical examination. So you're reviewing the description of the evaluation and management notes, whether you're using medical decision making or time. But what I really want to talk about, right? Keisha's pet fees. You want to make sure that the medication lists are up to date, right? You're reviewing you're going over with your physician why it's important to update the medication list every visit. If the patient is no longer on that medication, we want to remove it from the list, right? Remove it. I went to the doctor with my mom the other day and I love it. Till now, her doctor has no idea what I do. And maybe one day I'll tell him, but not today. He reviews the medication list, each one. Are you still on this? Are you still on this? Okay, let me remove this. That is important, especially if we're giving credit, that you reviewed medications, right? And that you're linking medications to the diagnosis codes, right? For risk adjustment, we have to see a linkage there. For medical decision making, we have to see that you analyze, right? You assessed, you updated the prescriptions, is noted, so that we can link it. We never want to assume, because if anyone ever did the pharmacology with the CRC that I teach, we go over the list of medications, but as well as you notice that multiple medications can be taken for a particular condition. Chemotherapy, for example, is not just for cancer patients, it's also used for patients with rheumatoid arthritis, right? So we never want to assume we need it to be updated, we need it to be linked. The correct dosage is noted. If you change the patient's medication, the current dosage is in the chart. The next thing, problem lists, right? The problem lists are always a problem. We want to make sure in 2026 they are not a problem. So if you're no longer addressing a condition, if it has resolved, if there's no more evidence of disease, right? We're moving it from that current problem list and we're only seeing active conditions, right? So we want to pay attention to these things going into 2026. But again, whether you're doing it for evaluation and management, whether you're doing it for risk adjustment, documentation needs to be clear, concise, up to date. And if you're finding inconsistencies, query the provider, But provider education is super important, right? Not just quota education, audit education, but we need the physicians to know. We need the residents that's documenting in there to know. We need the nurse practitioners, the PAs, right? You don't want to have Keisha running behind you. No, I don't mind. I'll run behind you in heels, but we want to set this tone for compliant documentation as we exit 2025 and go into 2026. So put that on your plan. Make sure that it's updated and stay tuned as we continue to discuss medical decision making, compliance, everything when it comes to documentation, risk adjustment, telehealth. There's so much happening here. So buckle your seatbelts. We're in for a ride, a bumpy ride, right? Leaving 2026, 2025, going into 2026, but we're going to make sure that everyone's staying compliant. So thank you for tuning in, listening, liking, subscribing, and sharing, and I will see you next time.